everyone. Thank you for coming. My name is Jess, and I'll be chairing tonight's event on COVID, One Disease, Two Systems. Before we get started, we just ask that everyone please silence your cell phones and remember to keep your mask on at all times. Next slide. Great. So this event is hosted by the Party for Socialism and Liberation. We are a party of workers who are committed to building a revolutionary socialist movement in the U.S. and organizing in all of the struggles that involve working people. If you would like to get involved or learn more about the PSL, please visit our website, which is up there, or talk to one of us after tonight's program. And this event is a part of our Liberation Month series on China Beyond the Propaganda. So next in this series, we'll be having a discussion on China and Africa. That's on Friday the 25th. Keep an eye on our social media for the location and timing of that. And we also want to invite all of you to join us and our friends at Pivot to Peace for an action in front of the White House next Sunday the 27th, demanding that an end to U.S. intervention in Taiwan on the 50th anniversary of the Shanghai Communique. I'd now like to introduce Hudson, who is going to present our first topic in tonight's presentation.
No, it's okay. Hi, I'm not Hudson, I'm Ben. I'm going to mainly talk about tonight the Chinese response to COVID, but before I got into how they achieved this number, two deaths, COVID-related deaths in 2021. I also wanted to kind of compare it to the United States. There is a bar right here. If you can't see it, maybe we don't have enough pixels. But I think it's kind of like a stark reminder of there being while there's one virus, there's two ways to go about it. I think even today, there's probably been thousands of deaths in the United States just in a matter of hours, and there's really no plan to deal with that. I want to kind of highlight that it's not impossible to fight COVID. I think there's been a lot of despair over the past 2 years, and just this kind of being completely full of hopelessness about the issue. And so I hope that we can learn from China just through, I guess, what I will get into. So if you could do the next slide. So this is in January 6th, bad timing. We put a article out through the party newspaper, just saying, yes, there really were only 2 COVID deaths in mainland China. Here's how they did it. So I'm going to be basing a lot of what I present off of this piece of writing. It essentially it started with basically a very off-the-cuff tweet comparing these two numbers, 2 versus around 300,000 deaths, it was 415,000 deaths, and so that caused a big uproar. You had far-right pundits like Ben Shapiro attacking the party, saying these people are nuts, whatever. Obviously the left and the right and the liberals and any sort of corporate media kind of coalesce to basically say this can't be just a bunch of radical socialists or whatever, which perhaps is true, but they're trying to cover up the fact that this is actually possible. They would rather create a situation in which people are suspicious of that number than kind of think inwards and say, why isn't Washington taking care of our own people in the same way, in the same level of militants that we want to save lives over profit. So next slide. So these are a few key parts of China's COVID response. So you have a population of 1.4 billion. Regarding COVID deaths, it this is, I think, a rough number based off of, I mean, no number will be quite exact, but this is a number around what it's at currently. So that's 4,636 deaths. So I just want to kind of read a little bit about this number of two people dying in mainland China of COVID in 2021. So it is widely accepted that only 2 people died of the disease in China in 2021 on the mainland, plus 64 deaths in the Hong Kong Special Administrative Region and 843 in Taiwan, where the central government of China does not exercise control. This is all according to the Johns Hopkins University Center for System Science and Engineering COVID Data Repository. So this isn't just a number that is believed by the Chinese Communist Party, only like the Party for Socialism and Liberation. This is a number that is widely accepted among the international healthcare medical community. One of the things that basically started this idea that we need a plan within China was the SARS outbreak in 2003. If you were, I guess, old enough to remember that, this was a major sort of event in China and globally, but the leadership in Beijing decided we can't struggle like this again. We need a national plan to basically prep and be able to respond to the next inevitable instance that there is going to be a pandemic. It is a fact of life. We know maybe back then it was once in a lifetime event. With climate change, that there is an increase of diseases, airborne diseases, and so this is something that we need to face as a reality, and a government that cares about its people on a baseline level of just health-related reasons, needs to take this into account. So in 2006, they came up with the National Emergency Plan for Public Health Emergencies, and basically it's like a comprehensive plan to prepare for contagious disease outbreaks, and this has been enacted throughout China, obviously. There's not necessarily like a response in Wuhan that's different from Xi'an. Because they have a government that is centralized and can work in tandem and coordination with each other, you don't have an instance where New York and Florida are acting in completely different ways. Maryland, Virginia, DC, Virginia, whatnot. And there's actually like a concerted effort to actually eliminate the virus rather than turn it into sort of like a culture war of sorts. As soon as the outbreak in Wuhan was basically discovered as like a novel viral pneumonia, authorities required all suspected or confirmed COVID-19 patients to be admitted to the infectious disease hospitals. Several temporary hospitals were built within a matter of days. Public health authorities were able to request external assistance to 42,322 healthcare workers, and they were deployed in Wuhan and the surrounding Hubei province. National and local healthcare authorities established an epidemic response command center, which directed the efforts of healthcare workers across the province. This is where you see the ability to basically identify the sort of DNA makeup of COVID like within days. This is something that I like really can't even imagine possible in the United States. And so they were able to quickly process and disseminate information on evolving best practices for diagnosing and treating the disease using social media posts, a regular newsletter, and a daily online webinar attended by hundreds of thousands of healthcare professionals across China. So communication is like one of the main key points of combating COVID in China. On top of that, hospitals in every city were retrofitted to prevent droplet and airborne viral transmission. Lines of communication were established so that frontline health care workers could easily report and access accurate and up-to-date information as any outbreaks developed. Offices, stores, transit stations, and other public spaces implemented temperature checks and testing centers to identify new cases, often before they become even symptomatic. A contact tracing app was created to notify anybody who came in contact and inform them on exactly how they should quarantine or prepare or get tested. All of this information was published about every known outbreak, and on top of that, they're able to, like, through this sort of initiative that they take with confronting these outbreaks, they've been able to institute these sort of local precision lockdowns, and that, like, how that looks basically is if an outbreak of COVID appears in DC and it's in a specific ward, you're able to lock down certain neighborhoods, test everybody there, give them the treatment, quarantine them, and make sure it doesn't spread to the rest of the city. And the rest of the city can, like, live their own life. It doesn't become like a thing that, like, destroys all of our lives. So that's something that I always keep in mind is something that, like, just we can't do. Like, we operate off of like, just sort of anarchy of testing. So local governments work with mass organizations to deliver free food and basic necessities to those instructed to stay at home. Businesses are also required to continue paying workers during lockdowns, which you forget it. And with an 89% home ownership rate and extremely low rents, there is no eviction crisis in the United States. There's no need to. I mean, you'll see how many people have been evicted. At least the last time it was checked. I don't know if they still track it, just because it's been, like, a disaster. But on the top of that, while there's been many successes, the Chinese Communist Party has also been able to disseminate, like, errors in the ways that this isn't just sort of like like they're trying to hide everything or whatever. This is an effort to defeat a virus. So in late December 2021, a couple of months ago, the Communist Party, their aligned media, I think it was Xinhua News, they repeatedly reported about issues regarding slow food delivery programs, price gouging during food shortages, as well as computerized health system crashes. While the US right now treats each outbreak as if they had learned nothing since March 2020, each outbreak within China is a moment of learning. And for government officials, the medical community, and Chinese citizens. And I think a key element of this whole thing has been the organization and mass mobilization of society to combat the pandemic. Like the fact that they've been able to include volunteers, workers from every sector of the economy in stopping the transmission has really been, like, a major part of why this effort is so successful. I think if you could go to the next slide. These are just some, I think, images I thought were important to kind of highlight. So on the left, you see, like, a sort of mass testing center that is volunteer run. You have a similar hospital of a lot of people who are either medical professionals from around the country, whatever. You have the delivery system that has had issues but are being worked on. You have the intention to share the vaccine. I mean, they used to call it vaccine diplomacy, which I think the Western media has kind of put to bed because they realized how, like, stupid that sounds. It's like, God forbid China wants to, like, end these sort of COVID variants in the global south that keep popping up and prolonging the worldwide pandemic. And then you also have the instance of when Wuhan was able to kind of return to normalcy. And then very quickly before I let Hudson take over, I just wanted to talk about, like, the idea of, like, a cover-up in terms of this number, like 2 people that have died. So there's certain Western media, they've kind of created these machine learning models to estimate how on earth, the real number. So you have the economists, they have this machine learning model, and basically they come up with a number of 1.7 million deaths. So, like, 1.7 million dead people would leave 1.7 million bodies. Like, you have to kind of consider the fact that that's impossible to hide. Like you had the instance in India where Narendra Modi was saying, oh, that like we're responding to COVID the best out of any country. It's not an issue here. But then very immediately you saw all these images, like horrific images of funeral pyres just like filling fields. And it's not. This would require a impossible conspiracy involving like 600,000 foreign nationals living in China, many who do not agree with the Chinese Communist Party, and this would along with the hundreds of millions of people who are frontline medical workers, people who are who have family in China but live here. Like we would know if they were covering it up, and you would have evidence that would allow for that. But it really, I mean, all you can say is that the U.S. media and the Western media is just outright lying about this. I think the danger around that is the fact that, and this is, I spoke to a biostatistician. I still don't know how to pronounce it. But he said the main danger about this is it basically diminishes any hope for like successful public health practices. Like this is something that we need to learn from. This is something that we need to administer at our own to save, to basically put an end to this ongoing mass death event, and to diminish it by saying it's authoritarian, it's incorrect, it's overblown. You have people then just kind of denying it. It feeds into, it's sort of the liberal version of the right wing, basically casting doubt on like best practices. So that's kind of all I have for you. But I'll let Hudson take it over. Thank you.
Hello, everyone. So I'm going to talk about the U.S. response to COVID-19, and we all lived through this and how horrific it has been. So the U.S. has a population of 329.5 million, yet we've had about 1 million COVID deaths. So you can go to the next slide. So from the onset of the pandemic in early 2020, the United States government has really struggled with any kind of effective measures to prevent the spread of COVID. And this has enabled close to 1 million COVID deaths over this 2-year time span. The virus was downplayed as just a flu. Effective public health policies were denounced as authoritarian. Most responses were left for private corporations to take care of with profit in mind. And without a united federal response, we are left with 50 different responses from the 50 different states. This leads us to a present situation where just 3,000 people died of COVID yesterday, 2 years into the pandemic. So here we have some images that I'm sure we all remember over the past 2 years, where we have mass graves, red lines in Texas, and then we've seen tent cities. They've existed before the pandemic, but we've seen them popped up more. We've seen them demolished throughout the pandemic, etc. Next slide, please. So the popular strategy of blaming China and their Communist Party leads to the framing of effective strategies to contain the pandemic as authoritarian, not something a free society like ours to do. I'd like to pose a couple of questions. Are these things really authoritarian or simply effective public health measures? Mask mandates or allowing 1 million people to die of a preventable disease? Precision lockdowns with mass testing and contact tracing, or leaving 6.4 million households on the verge of eviction, with 800,000 filings already in motion? Free N95 mask and COVID testing, or cutting unemployment and forcing workers into unsafe workplaces with little to no sick leave? Truly, it is not a useful way of talking about these issues. Using words like authoritarian only provide a political cover for U.S. inaction to the virus. Next slide, please. So a big part of effective pandemic strategy is making sure that the people on the front lines, the nurses and doctors and other healthcare workers that are essential if we get sick, are taken care of at their jobs. Healthcare workers need to have safe workplaces and to be compensated fairly for their work. Currently, 1 in 3 physicians, APPs, and nurses surveyed intend to reduce work hours. 1 in 5 physicians and 2 in 5 nurses intend to leave their practice altogether, according to the Bureau of Labor Statistics. Next slide, please. And so we're seeing a lot of talk in the press about a nurse shortage and how it is caused by COVID. What this framing is missing is that it's actually because of our profit-based healthcare system. In order to increase profits, hospitals will deliberately understaff nurses to cut costs. In a survey of thousands of nurses by National Nurses United, 83% responded that at least half of their shifts were understaffed, and 68% said they've considered leaving the position, but they would stop if working conditions improved. A U.S. Department of Health and Human Services report indicated in 2017 that 43 states will have a nurse surplus by 2030. And using New York City as an example, we find ourselves in a situation where there are actually less nurses currently employed in the city than at the start of the pandemic. This could only happen in a system that is focused more on private profit than human well-being. Next slide, please. The U.S. government, along with state governments, has left workers out to dry. By cutting unemployment benefits for 10 million people and leaving 7 million without any benefits, not extending the eviction moratorium or any kind of rental or mortgage freeze at all, a measly stimulus package totaling $3,200 for each American, hardly enough to cover even 3 months' rent in most places, and there was no free delivery of proper PPE. Until recently in DC, that is. One could ask how all this would be paid for, but just look at the $76 billion in fraud and the loans to businesses, or even the extra $25 billion the Pentagon received. Not to mention just the huge military budget in general. The money is clearly there. The priority is simply not to help and protect the people living in the country. Next slide, please. This also extends to the citizens of the world. Despite calls to release the intellectual property of vaccines to help poor nations access the vaccine and protect their citizens, the U.S. government has done nothing to make this a reality. Releasing the IP would hurt the profits of big pharmaceutical companies, but ultimately prevent so many needless deaths and hardship around the world. When the vaccine was first released in the U.S., the U.S. was hoarding the vaccine, having more than double what the population of the states needed to be fully vaccinated. At a time when other countries desperately needed the help, the United States did not show up as a team player. This kind of vaccine apartheid policy leads to more deaths and more variants, leading to a prolonged pandemic. The United States also chose to pursue a profitable, innovative vaccine technology instead of older, reliable technology that, if invested in, could have been a solution sooner and more rapidly distributed around the world. There's a vaccine called Corbevax, and it is a great example of this technology. Corbevax uses technology from a 2003 SARS outbreak, and it uses proteins from a virus that induce an immune response, kind of like the vaccines we're used to. And clinical trials have shown that it's about 90% effective against the original strain and 80% effective against Delta. The best thing about Corbevax is that the intellectual property is available for everyone. It could be produced in Senegal, South Africa, India, and plenty of other countries. The one drawback to this vaccine, it is not able to be modified as quickly. However, if this option was pursued from the beginning and distributed and produced around the world, it could easily be said that more people would have been vaccinated against the original strain quicker, leading to less death and less strains from the beginning. The real drawback to this vaccine for the U.S. capital system is that it does not make a profit. Next slide, please. And so as we approach 2 years of living in the pandemic, we see more and more articles, opinion pieces, media attention to the idea of living with COVID. I think it is true that because of the non-response of the U.S. to the virus, we may well be living with COVID for longer, especially if we continue to not respond. But living with COVID is not a real public health response and not an option if we value human life. Looking at a couple articles here, we have one from the New York Times saying, "Scientists prepare for the next phase of learning to live with COVID." The subheading says, "Masks, vaccines, and paid sick leave may allow the pandemic to enter a new phase with fewer restrictions." And this might be true. Those are all good things. But when has paid sick leave been an option for workers in this country, and especially over the pandemic? Why is it going to start all of a sudden? Why would we believe it would start all of a sudden? Next, we have this article from Time magazine indicating that we are still living with a 2020 mindset. Well, more and more people are still dying. Like I said at the beginning, 3,000 still yesterday. So why would we not be living with a similar mindset of things are still terrible and we need to be cautious? And then lastly, this article from Financial Times, which says, there's a good chance the global impact of coronavirus will ease. It then goes on to say, the top priority is therefore to vaccinate the whole world, as it should have been for the past year. Unfortunately, COVID-19 vaccine inequity has never been greater, with just 10% of the population in low-income countries have received at least one jab. If this is the reality, how can we say that it will ease without definite action? What we can say is living with COVID is not a proper pandemic response, but it has been the non-response of the US government. And that is the reality of a system that is based on profit generation over human welfare. And this can be contrasted with everything Ben just said about how China operates and the inaction of the United States government. I will now turn to Julia.
So, since the onset of the COVID-19 pandemic, the U.S. corporate media apparatus, in conjunction with the imperialist state, waged an information war against the Chinese government and Chinese people over the country's handling of the virus. So, while Trump's anti-China demagoguery at the beginning of the pandemic was appalling, albeit unsurprising, so-called liberal media outlets, along with the Biden administration, are still ramping up rhetoric against the socialist state. The mainstream media unfurled heinous accusations of China deliberately creating the virus and blaming Chinese people for spreading it. Misnomers such as the China virus or the Wuhan virus flooded the news and were propagated by Trump. Hate crimes, as a result, spiked dramatically in New York City and California, where there's a large Asian diaspora, and Chinatown restaurants and shop owners lost business as corporate media fear-mongering against China drove bigotry and xenophobia. Now, ironically enough, the same media outlets that once blamed China for not doing enough to stop the spread did a complete 180 and called its successful lockdown efforts authoritarian. Still, to this day, as China concludes the Winter Olympic Games, Western media has been attacking its zero COVID policy. One headline that you can see on the screen refers to the games as quieter and scarier. And I don't know about you all, but I personally would be more scared if I faced a much greater risk at getting COVID if I were competing in the Olympic Games or watching. So for a long time, the US media has portrayed China as the boogeyman, a threat to the pillars of supposed Western democracy. And this, unfortunately, is nothing new. Back in the early 20th century, the phrase yellow peril plagued newspapers, owned by the infamous William Hearst, a media mogul whose publications were known for their violent jingoism. This, of course, is not the only example. The US has long harbored racist sentiment towards Asian and specifically Chinese people, and we see that with the Chinese Exclusion Act of 1882, anti-communist fear-mongering during the Cold War, and violence towards South Asians after 9/11. You can go to the next slide. So the Orientalist tropes against China depicted in media throughout history and in present day reflects the observations of Pan-Africanist anti-colonial Marxist psychiatrist Frantz Fanon, written in his final book, Wretched of the Earth, that he finished before his untimely death. This passage says, "Native society is not simply described as a society lacking in values. It is not enough for the colonists to affirm that these values have disappeared from, or still better never existed in, the colonial world. The native is declared insensible to ethics. He represents not only the absence of values, but also the negation of values. He is, let us dare to admit, the enemy of values. And in this sense, he is the absolute evil. He is the corrosive element, destroying all that comes near him. He is the deforming element, disfiguring all that has to do with beauty or morality. He is the depository of maleficent powers, the unconscious and irretrievable instrument of blind forces." So does this sound familiar? Because it sounds a lot like how the mainstream media talks about China. And while Trump was more overt in his Chinese bigotry, President Biden takes a much more covert approach. However, his policy towards China mirrors Trump's. The trade war with China was waged in the Trump era, but Biden continues xenophobic policies and imperialistic policies. Recently joining the AUKUS Pact, the U.S. has played a pivotal role in allying with other imperialist nations in countering China in the Pacific. But this pivot to Asia has long been in the works since the end of Obama's presidency. You can go to the next slide. On the tragic day of March 16, 2021, a white supremacist committed a series of terrorist attacks that targeted spas staffed by Asian workers. As a result, he killed 8 people, 6 of them were women. And this is just one of many attacks, as you can see, and a very violent example of the anti-Asian hate epidemic that has existed over the past decade and has spiked in the past 2 years. Despite Biden's lip service towards social movements and placing the blame of bigotry on Trump's presidency, he continues to use hawkish rhetoric towards China that fuels widespread xenophobia. We can only win this fight against racism if we also fight to end U.S. imperialism and reject corporate media's xenophobic rhetoric.
Okay, thank you, Julia, Ben, and Hudson, for such an informative presentation. And now let's talk about it. So we have a couple of discussion questions. If folks want to talk to the people in your row or the 2 rows about either of these 2 questions for the next few minutes. First question is, should we be more surprised at this number of 2 COVID deaths in China, or that the U.S. has allowed almost 1 million to die from COVID? And the second question is, what are some key differences in the Chinese socialist model and the U.S. imperialist model that have been highlighted through the COVID pandemic? So talk amongst yourselves for the next 10 minutes or so, and then each group can choose a person to share some highlights.
Wow, 2 speakers and so much. Wow, perfect. Damn, all right. Yeah, you guys all did really well. Very clear, very precise, very effective.
I didn't realize how difficult it was because our car voice was a mask on. Felt like I was going to hyperventilate.
Yeah.
Yeah.
I felt like I was going to do that.
No, you were perfectly paced. You sounded like a journalist. You are.
Yeah, so what do you think there, Sean?
I mean, you know, like, I'm surprised, you know, like, by the disparity in, like, the COVID deaths between, like, the socialist model and the capitalist model, because, you know, people over profits over in China. I mean, despite, like, you know, with the heavy liberalization of China over, like, the past 20 years, it's, like, deliberalizing. Thank you, Comrade Xi, but, you know, like, yeah, doing great work out there, and I'm unsurprised at the, you know, the disparity.
I was gonna, sorry, I'm glad you brought that up, because
I mean, like, I'm close friends with Julia. I'm already in on all of this, you know, like, I see
advocacy group of like libertarian style Medicare.
It sucks that it's not surprising.
Like lobbying. I mean, actually met with.
I'm more not surprised with the
Yeah, same. I'm just appalled, but I'm not surprised.
Yeah, exactly.
Meanwhile,
It's like absolutely despicable.
but they were like, well, they shouldn't even be counting on.
But even then, it's like, yeah, you know, that's less workers around, you know, like, yeah.
It's not even efficient for capitalism. It's just
Exactly.
I think something else, which I probably, I don't know if I'm saying this personal, but what's the interesting thing about like how people have been like, oh, supply chain issues and stuff, but like China makes everything. And people are like, the only reason people are still in the body is because they have handled everything effectively. They can go back to work, they can do all these things that, you know, we're not doing. I think it's just like more proof that they're handling it, you know?
Yeah.
So,
And I find the China numbers of the 2 deaths in mainland
I
China
that earlier back in March 2020 it did
surprising just from the perspective as like being a person in America.
That's some
No, literally, that March, that February, I was like, China's got it. It's a flu. We'll be good. And then here we are.
Yeah, no, yeah. I don't know if I could have myself, you know, here 2 years.
It's
But
hard,
yeah.
like, from, I guess, from our perspective,
I
also remember it's like, wow,
It's done a lot.
what can we achieve?
Mentally and physically, it's insane.
And to think that, like, that
Yeah,
could be
I think,
applied
and
to the
so I
US
mentioned
government,
the,
the US
like,
government
that article,
taking
you know,
those
saying
actions, it's
like paid sick leave and everything. But I just think
Well,
it's
it's
so.
not even, I mean, the way, like,
When have we ever
the way
had
they
paid
sort
sick?
of
I mean, I had paid sick leave in my job, but that's not the reality of like
to this
when
sort of
most people
zero
have.
COVID.
Yeah,
That's like
response
after 2
always
years,
kind of
it
doesn't really make
then you
sense
want
to me because
I mean,
there
of
are
course,
some
it reported in
countries,
New York
like
Times,
New
6
Zealand,
years later,
I think Singapore as well.
Financial Times, I don't know, it's
Like South Korea,
regardless, it's just,
and like,
just so.
granted, these have all had
Negative.
like more negative success. I think because, as I mentioned, like they don't engage like the masses of people. They don't bring in these like mass organizations
Yeah,
or
even
volunteer
in like
groups
capitalist
to kind
countries
of
in
combat it
Europe,
on
it's
a
all
larger scale. So there is sort of like they're not getting like basically no one like they're not experiencing a problem. They still make they're getting like dozens of deaths.
We really
hundreds
are.
of deaths. Still a lot.
It's a close matchup
but
between
it's-
us and the UK.
These things
Yeah,
work.
yeah.
We're British, you know.
It was done, but we
Legacy.
like
Yeah.
sold
We
it.
can't.
Yeah.
Yeah,
That's
we're
the main
we're
thing for
taking
me.
the
Is like we
stage.
can't like this.
When
We
I
can't
think
act
even
as if
New
like
Zealand did
systems
kind of like
don't
similar
work.
measures to China, and they still has like a pretty low.
But they're also, what I notice is that they get praised.
Yeah,
Mhm.
yeah, exactly.
Yeah,
Which is like, yeah, but like, where's that same energy for China?
racism, baby.
New Zealand doesn't represent a threat to the United States global domination.
I've been thinking about that recently, like when you look at the capitalist countries that have like done
In the United States, you have the freedom to stop. You have the freedom to not
it kind of shows that there's also
you
this
have the freedom
component of
to
like
catch a deadly illness
people
and potentially die.
valuing like
Whereas in China,
community over their own individual like freedoms and whatever, which is such a thing in the US.
Yeah.
Clearly don't have to worry about
Yeah, I think it's just like,
uh,
even if it's something stupid, like wearing a mask, like people in here just don't like being told what to do.
Yeah.
Yeah.
huge.
And like what everyone wanted to do is like
In
all those big like anti-lockdown protests, like they want to get their hair done, they want to go to the bar, they want to go to sports games or whatever, and it's just like that's like what you're like want to let people die over,
Like literally.
just go for a walk, man.
There's a cut around here.
Go to the grocery store and buy a 6-pack. I don't know. Like,
Literally.
I just don't like.
You don't need to go.
I've never
You don't
once
even
felt
need to be
like.
vaccinated to go to the grocery store too. It's not like these vax requirements are like preventing people from like functioning.
So it's like
there were thousands of cases.
My roommate said some
At the beginning of the year.
today, where he's just like, he thinks
That
Americans
now
are just broken at this point. I mean, they've been broken, but like very broken. They're just like.
Literally the worst.
It's disappointing to see how many people even on the left are like,
So I think it's just like all just like really.
yeah, it's weird.
Yeah.
You have. There is no real freedom.
it's really frustrating.
I've been seeing like a lot of like people on the left take on like I'm not super well read in Foucault for good reason because I don't care about Foucault, but a lot of them using like Foucault's language of like power and like I think it's biopolitics to like defy lockdowns and like mask mandates, and I'm like, guys, what are you talking about? I mean, I understand where they're coming from because of the exercise of power that the state is able to use in response to like the COVID-19 crisis, but at the same time, it's like
in the 70s,
kind of
sort of like
a necessary use of
Yeah.
power. Like,
Even if it's done by somebody who's like,
yeah, no, exactly. It's just like watching like the left, like kind of splinter. I mean, it's not like a lot of people on the left. It's just like a subreddit, like 5,000 people in it that I was looking into, but I was still just
Mr.
like,
Carter, like
how are you guys all
like,
debating
we'll
this
look
so
at
hard? Like, what is wrong with you?
we'll help you fight racism.
well, I mean,
We'll
like people on the left
build
are
the
still.
freedom against racism and poverty and all that.
Yeah.
It's
Yeah.
like something that we're all in, you know.
Yeah.
I think
It is a
that's like one of
process.
those things
Like,
that
the
becomes
like,
psychologically
burned into our minds. It's so
Yeah, like I mean, I don't like
Yeah.
it.
Yeah, same.
more of their identity.
But around like trivial, I think.
Yeah, not around
still
races
use
and not
them to
killing
kill
people.
Yeah, no, exactly.
Yeah.
in a society, like only
There's
more
this
like
really big disregard for art in this country.
Yeah.
And you see even just like the way people drive.
like
Like that's I see like you know I got hit by a car the other day, but like I mean it literally just like tapped my thigh like that. But I was just like, come on, guys, like I'm a person, you know, you're a person. You want to ruin your life for hitting me, like killing me, or like you know, like you want to ruin my life. And it's just like just like a basic thing about driving. People like, so then like
we're trying to like
a pandemic, you can't even see the virus. So people are just like,
it's just like
don't even care.
yeah, like
It's
it's
just
just
really,
such a fucking mess because we
people are
on top
definitely
of
just
not having a good COVID response.
Yeah, no, the car really like represents the American experience, like how like hyper individualized it is and how separated it is from people. We're all still so tightly stuck and compact together in traffic yet.
I think that's
So
even something that like the
isolated.
mainstream media is kind of like forced to admit.
Yeah, that's why I don't drive.
I always see they.
Just kidding, I'm not that deep,
Oh,
but
that's awesome.
I'm also scared of
We
driving.
also didn't really have that many.
When my car finally died,
It's
it's
like we
BBC, but now I
there's
have
all this
access
house like
to different
housing
car and
issues.
like
But like we also did
but
have
I
like,
still it's like
hundreds of thousands.
try to be very careful and mindful, but and also
It
not
really
using
made
every
me
have to.
tired.
And if that car dies,
It's
I
like
mean,
the
it's that
last
person, not the
Yeah.
car. I don't have access to it.
I've been here for like 7-8 years now. I've never. I used a car once, but I was borrowing it, and that was like during the beginning of the pandemic to drive better.
Yeah.
And that was like easy to drive. Yeah.
I was so surprised when you picked me up in your mom's car in Philly. It's like, dude, you can drive.
Yeah.
It was so fucking fun because we never drive. We never talk about cars or shit, which is good. Thank God.
Alright, folks want to wrap up convo?
Gotta bang the gavel.
I'll give people a few seconds to finish the thought. Alright, so does anyone want to share out some of the things you discussed with your group?
In our group, we talked about how we feel like the 1 million deaths in the U.S. unfortunately isn't surprising, but it is dropping because as some of the people who live here, we know how the capitalist system makes it harder to keep the pandemic. The 2 COVID deaths in China is surprising from an American perspective, where we're used to a capitalist system. But if for some people who live in a socialist country, then it's less surprising.
Absolutely, yeah. Anyone else want to share?
I think one thing that was really surprising was I remember in late January 2020 when nobody really understood what was going on, but seeing videos of China building 2 hospitals within 9 or 10 days, and I think that was just one of the best symbols and kind of examples of the capability and just the difference in approaches. And I mean, whether that be 2 or 3 positive COVID cases in a city of 15 or 20 million and testing everyone within 2 or 3 days. And I think it's just a really significant contrast.
Definitely. Yep.
Another comment that came up is that when you already have an infrastructure of community networks and leaders and things, you can respond to the pandemic so much better. So that makes me think even right now, a little bit, I guess, pessimistic, but it would be a lot. We really have to get working on this so that we can respond appropriately and end this.
Definitely. Yep, Aria.
Yeah, I think something else that our group talked about similarly is how COVID has just really exposed all of the flaws of the capitalist system in the U.S. And the whole thing with COVID is it's not just its own separate issue, it's connected to so many different issues that we have in this country when it comes to housing and healthcare, access to jobs and food and that sort of thing. And it really, the reason, a big reason why the U.S. is struggling so much is because a crisis of this magnitude would require it to look inwards, if you will, look inwards at the system and see okay, well, why don't we have all these foundations in place to begin with? Why don't we have quality and accessible housing in this country? Why don't, same thing with healthcare and why are we okay with like throwing workers out on the front lines without proper PPE and the proper equipment and everything like that. So yeah, I guess just really it exposes the flaws that we have.
Okay, so going off what you said, another thing that came up in our group is like just how petty the United States is during the Olympics, and because of these things. And I just wanted to add on that, like, obviously COVID, the pandemic has just exposed all the flaws about capitalism and the structures in our society. And the one thing that's like holding the American populace or working class back from like really looking at other models, especially China, is the propaganda about Xinjiang and Hong Kong. Like, if that was off the table, then like they wouldn't have anything on us. And I really think that, like, I know that's what the way I frame that, but like that's really the only thing that they have. And you just have to think about how intentional that is. Like, obviously, I don't think that they knew that the COVID-19 pandemic was going to happen. But just to think that they have this propaganda building up, festering, so no one in the working class or on the left would want to look and organize in the way that, like, China does. So.
Very true. And now they're shifting that propaganda to Taiwan recently, as we've been seeing. Anyone else have any thoughts to share? Yep.
Yeah, what I think about the COVID-19 pandemic and the responses to that between China and the United States, I'm thinking about the second question on the differences between the China social system and our capitalist hellscape, is that it really just exposes this mythology of freedom. For all the myth making, for all the propaganda that we hear about China's so-called authoritarianism, including with its COVID-19 response, you never really hear about what you have in the United States. You have freedom. You have the freedom to starve. You have the freedom to not be housed. You have the freedom to go to work sick if you have a job in the first place. That's your freedom in the United States. You have the freedom to be subjected to the wills of the capitalist system, and for you to starve, be houseless, go to work sick, or not have a job and die, because that's what the system wants from you. I don't know about y'all, but I don't think that's freedom. I think that having food, having housing, having work, having the essentials of life is a lot more free than what we have here.
True.
Very well said. Yeah, if no one else has anything to share, we can wrap up with talking about a socialist plan to defeat COVID. So I'm sure that everything that we've heard tonight has kind of left us all wondering, like, what lessons can we learn from these two different responses to the pandemic? And one thing is very clear, at least to me, we need a socialist plan to defeat COVID. So in the United States, this would mean rebuilding public trust in the medical and scientific establishments after the capitalist class let almost 1 million Americans die of COVID. It also means forgiving all rental, medical, and student loan debt and placing a nationwide freeze on all evictions. So no one has to worry about facing houselessness in the middle of the pandemic or ever. It also means that we need an income guarantee so that workers don't have to risk their lives just to make ends meet. And we need to place pharmaceutical companies under the people's control to ensure that vaccine access is available to everyone. These are just a few of the key points of the socialist plan to defeat COVID-19. You all can read the full plan published by the PSL at liberationnews.org. And yeah, with that, thank you so much, everyone who joined us tonight, including the folks watching on the live stream. I see you. Hope you enjoyed this event and have been enjoying the Liberation Month series overall. In order to keep events like this going, we hope you'll make a generous donation through our Venmo or through the cash box at the merch table back there, I think. Yes, Annie has it. Yeah. Make sure to follow PSLDC on Twitter, Instagram, Facebook, all the places. Find out about future events like this. And we hope to see all of you at the U.S. Hands Off Taiwan action next Sunday in front of the White House, 1 p.m., 27. Yes, have a great night.